most other offices, you walk in, they go, back pain? We should give you something for back pain. Here's a prescription, anti-inflammatory, muscle relaxer, an opioid. Now, to show you how out of control it is, the treatment of opioids, the use of opioids treating back pain started in about the 1990s. Since that time, we've gone from an average of 11,000 people dying of an overdose in this country a year to 150,000 dying of an overdose in a year. And it's estimated by the Lancet Medical Journal in England that from now until 2030, which is 8 years, 6 years now, when they wrote this, it was 8 years, they estimated 150,000 people a year would die from opioid overdose in the United States. And the number one thing is prescribed for is back pain. So we've gotten way out of control. It is now so common for Americans to die of an opioid overdose. It is the number one cause of death in the United States for Americans under the age of 50. So if you go on the CDC website, they'll have a map there showing you how the number of prescriptions have decreased over the last 10 years, which is true. The number of prescriptions have decreased. The problem is, it isn't the number of new prescriptions, it's the number of later prescriptions. These people are still getting addicted, and we still have record death rate from opioids in this country. There's a big market for this in this country. If you look at the numbers, the chiropractic profession in this country generates about $15 billion a year. But treatment of pain in this country is $800 billion a year. And if you look at pain in the spine, neck and low back, the Institute of Health Metrics and Evaluation of the University of Washington Medical School says 60% of that 800 is for spinal pain, which is $480 billion. That's a lot of money. That is why nobody's taking the steps to try to get a functional correction of these people. Well, at AMI, we recognize our job is not to cover up their symptoms. At AMI, we recognize the job of the doctor is to figure out why is the patient having symptoms, what is not working, get that working so the symptoms go away and stay away. That would lead to a healthy population. That is the purpose of why we do what we do.